Hi, if you've got a chronic neurodegenerative condition, if you're suffering from loss of strength as you're getting older, if your doctors have told you that there's no hope or told your family members that there's no hope in you getting better, getting stronger, you really deserve to listen to this discussion that we're going to have right now with this lovely couple, Mr. and Mrs. Kent, who come to my clinic in South Florida from Mississippi. And then after this discussion, you're also going to have another video that you can watch with me describing what I've been able to find in this unique exam process and treatment process that I'm doing with her and for her, them, as a couple, to be able to get her stronger. So if I can ask you, Mr. Kent, so Mrs. Kent is the patient here, but you started with me, I'm just going to say she started care with me back, it was about December of 2018. Right now we're in October of 2019. So we're talking maybe 10 months of knowing each other, right? And you've been to my clinic, today is the third time. Yeah. So you've had so far 2 exams and 2 treatments. Right. In addition to the dental work I had sent you out to take care of, because I found some problems in the mouth that were part of the body. So when you found me because well, she had high blood pressure. How long was she on blood pressure medication?
10 years.
And she also was diagnosed with type 2 diabetes.
Type 2 diabetes for 10 years.
10 years of that. And over time with the medications, and how many different kind of medications was she taking?
She was in 23 different meds.
23 different meds.
Yes, sir.
For about 10 years of that time?
Pretty much. Probably about the last 5 years.
5 years, 23 meds.
23 meds. Yeah.
And over that period of time with all the medication, that was prescribed by different doctors. Now, she had what? She had a cardiologist?
Cardiologist.
A neurologist she saw?
Neurologist.
Did she have a kidney doctor? Was that part? Endocrinologist for the diabetes?
Yeah, endocrinology and a general practitioner, yes.
And so with those doctors and the 23 different medications, what did you notice about her cognitive, her mental function? Was it getting stronger and better, or was it declining?
She was declining big time. Her health was deteriorating despite the fact that she was taking so many meds and it wasn't no help at all.
There was no help. So it was deteriorating. So the mental health and the whole mental, everything was declining. And when you said with mental decline, what was it that you noticed about her? You were telling me about what she would, with people in your environment. What was happening?
She wasn't able to recognize people or places or where she was at. And she had no idea.
She had no idea.
Oh yeah.
So even like a family member, she couldn't remember who that person was?
Some of the family members now.
And she knew those people for years?
For years, yes.
Yeah, so that would be in medicine, they might call that dementia.
Pretty
They
much.
might call that dementia, that she couldn't remember even people that she was close to. And she couldn't remember buildings where she went, or even home. Like where
even home, yeah.
Even home, she'd look around and say, where am I?
Come on.
Yeah, so that dementia. And so there's a neuro decline, a brain decline that was taking place, and I'll get more into that in another video, because we're going to talk here about these improvements here. And then I'll let them go, and you'll hear the improvements. So addition to the cognitive decline, addition to the memory decline, what was happening to her strength, to her body's ability to do certain things around? Daily activities, what was happening?
Yeah, she was weak. She wasn't able to do anything. She wasn't even able to get off her bed.
Get out the bed.
Couldn't even get off the bed. So you couldn't even sit up on the bed yourself.
I had help.
Somebody had to actually pick you up from lying down position. And that to stand up from the bed was, for you, just by yourself, was it possible or impossible?
It was hard.
It was hard. Was it hard to where you could do it even with extra effort, or were you unable
No,
without
they
help?
had to help me.
They had to help you. You had to have people picking you up from the bed.
Right.
And furthermore, with the strength, just sitting down in a chair, could she get up on her own before this? Now, was she
Pretty
able to
much at one time, doctor, we have a Hoyer that I purchased, and we had to transfer her with a Hoyer from the bed to the wheelchair.
Wow.
And then secured her.
And secure her into the wheelchair.
Yeah.
Because she had no strength in the legs.
No strength in the legs.
She couldn't stand up by herself. And she also, you told me she had, what happened to the balance?
There was no balance at all.
There was no balance.
No balance at all.
So even when you sat her up on a bed, you and maybe another friend or family member helped sit her up on the bed, what would happen if you didn't hold her? What would happen to her?
She will fall.
She'd just fall
left, right, or fall on the back.
She'd fall back,
She would
left,
fall
right.
back,
She'd
yeah.
fall. She had no core strength to sit up anymore. And when you, with the Hoyer, to get her over to the wheelchair, the reason why you had the wheelchair was because...
Just to transfer her, move it around.
And that's because, could she walk on her own?
No.
And was she even able to move her legs if you held her or she had a walker before? Was she able to walk even with before?
No.
She couldn't.
No.
So it was total impossible, even with two people holding her, to move her legs.
Correct.
Her trying to move her legs and stand up and walk. Was it even possible if you had a walker or had crutches for her? Was she able to stand and walk on her own with those?
Negative, no.
Negative. So it was wheelchair and you had to wheel her around to hospitals and doctors and just around the house.
Exactly, yes.
And even to get her to go to the bathroom, you had to really assist her with that because
Yeah, we normally she used the bathroom in the bed.
in the bed.
Yeah.
You had something there to protect, and that's just how it had to
Yeah,
go.
we used the bedpan.
Yeah, a bedpan, and because it was just too much effort to pick her up and try to get her over to the toilet.
Yeah.
Yeah, how unfortunate. So with the doctors now, with seeing the cognitive decline that was taking place before this care, with the strength loss before this care, what did the general doctor, you had a general physician who came over to your house to assess her. What did he tell you after he assessed her?
He looked at her and kind of like turned around and looked at me. He said, Harold, when they get to this point, it's best to let them go. And I was kind of like blown away by that statement. You know, it was kind of like, so I let him go.
You let him go. So
Yeah.
again, he said, sometimes when it gets to this point, it's just best to let them
To let
go.
him go, yeah.
Yeah. And when you went to, you also told me that she had seen a neurologist. And what did that doctor say after evaluating her? Was it something along the same lines, or was
Yeah,
there any
something
other
along the same lines. There's nothing else that we can
Nothing
do
else we can
about
do.
it. It's not going to be an improvement.
No improvement. No, there's no improvement possible. There won't be, no matter what we
Yeah.
do. And
According to
and who sent her to physical therapy? What kind of doctor? I don't need the doctor's name, but what kind of practitioner sent her to physical therapy before coming here?
and that was the hospital.
A hospital.
Pretty
sent-
much, yeah.
Whoever the doctor was in the hospital
In the
said
hospital,
physical therapy.
sent it to physical therapy. Yeah.
And how long did she go to physical therapy for?
She was there for 6 months.
6 months. How many times a week for 6 months?
3 times a week.
3 times a week, 6 months.
And eventually the end result was there's nothing we can do. There's no improvement in 6 months, and there will be no improvement.
So they looked at her as there was no way.
No way.
If they couldn't do it, nobody else can.
Nobody else can do it.
And
Yes,
they
sir.
told you there's no hope.
No, yeah, basically yes.
So that's 3 times a week, 4 weeks, 24 weeks times 3. You're talking, she went there more than 70 times for physical therapy. She went there a lot, and
Yeah,
she couldn't get.
And they couldn't do nothing but
Let's
her.
go.
nothing.
She had 72 physical therapy treatments, and she couldn't get stronger, and they said there's no hope and there's no way.
Yeah.
So you started looking around online, and you found me, and we
found you
started
there.
together, and
I know I call you up and we had that.
we had that discussion,
Discussion,
and then
yes.
came right over, and basically, I mean, once you fit into my schedule. But what are we seeing now in her cognitive function? What do we see with her ability to know who's around her?
We've seen a huge improvement since we've been on your treatments, and we've seen the ability to strength has,
Is returning.
is returning.
Right.
His cognitive levels and move incredibly. It's a huge change
Huge.
in her, and then she just
She's coming back to
blossom-
life.
blossom,
She's
coming back to
blossoming.
life.
No, I see her today with the smiles and
Amen.
just, yeah. So with the cognitive, with the memory, does she remember all the people around her now?
Yeah.
She pretty much.
You do. Does she remember where she? Pretty much. Why is there somebody who she can't remember?
Well, I would say that some of the people that were just friends, and the old friends that we had,
Yeah,
and
from
she
the
had,
church, yeah.
yeah, but she remembered things that go going way back. It blew me away. Things that I have forgotten. That she
So
bringing
memory
back
is
up.
memories coming
Yeah,
back
it's
from a long
coming
time
back.
ago.
It's
Memory.
incredible.
What about family members or people who come to the house pretty frequently that she couldn't remember them before? Does she know who they are
She
now?
knows who they are now. Yes.
So we're not really worried about that dementia. What it
It's
was.
blossoming back. Yes, sir.
And the strength now, because you're going to see a video of her. I'll put this up on the screen. You'll see her going from months ago when we first started, where she could not get up out of the wheelchair by herself. And you're going to see the video I just took today,
Okay.
October 11th, 2019, where she's standing up out of this. There's still a struggle. She's still not incredibly strong, but
Come on.
the difference is it's night and day. True.
Yeah.
I mean, come on, you got up out of the chair yourself today,
Amen.
right?
Good.
She got up out of the chair herself,
Yeah.
which is amazing. And according to the doctors and according to the hospitals and the physical therapist, there was no chance.
Okay.
And what we're seeing now
No.
is this woman's life coming back to her.
Yes.
Yeah. Thank you. How much improvement, if you can give like a percentage, and whatever you say is right because you know your wife better than probably anybody else besides her. How much of a percentage of improvement would you say since before coming to me to now?
I will say it would be like a 70% improvement
And that's in 2 treatments.
into treatment.
2 treatments
Yes,
that you've
sir.
done at home. Were the treatments hard to follow?
No,
Simple.
none at all. Very simple.
Okay.
And just you feel the body coming back, it's just gradually improvement, yeah.
Yeah,
Is there anything that you could say to anybody out there who's listening to this who still wonders if their family member or themselves who have cognitive decline, who have strength decline, and the doctors can't help them? Do you think that, what do you think that they deserve to know about this work?
yeah, they deserve to know that the treatment that Dr. Herman's provide is that incredible, and they do work, and they have helped my wife tremendously. It's incredible, and I highly recommend for you guys to come down here to South Florida and visit and
And get your life back.
get your life
Amen.
back.
She's
Amen.
back. She's
Amen.
back. She's back. And she's only going to get stronger and stronger after this.
Hallelujah.
So you're going to stay tuned to another part of the video that I'll put up where I'll discuss the findings, and I look forward to helping you too. And this is when you see the before and after of her not getting out of the wheelchair to now. It's really impressive. And hopefully in the future, after this round, which is about 3 months, you have a protocol. When you come back and you'll be even stronger, that we can get another little sound bite from
Okay.
you that you're showing how much better you are.
All right. Okay.
Thank
good.
you. I appreciate it.